Welcome to Partners for Advancing Health Equity, a podcast bringing together people working on the forefront of addressing issues of health justice. Here, we create a space for in-depth conversations about what it will take to create the conditions that allow all people to live their healthiest life possible.
Hello, and welcome to the Partners for Advancing Health Equity podcast. I'm your host, Thomas Levis, Dean and Weatherhead Presidential Chair in Health Equity at the Tulane University School of Public Health and Tropical Medicine in New Orleans. I'm honored to be speaking today with Dr. Paula Braveman. Dr. Braveman is Professor of Family and Community Medicine and founding director of the Center for Health Equity at the University of California in San Francisco. For more than 25 years, she's studied and published extensively on health equity and the social determinants of health. Her research has focused on defining, measuring, and documenting socioeconomic and racial and ethnic disparities, particularly in maternal and infant health. During the 1990s, Dr. Braveman collaborated with the World Health Organization staff in Geneva to develop a global initiative on equity in health and healthcare. She's been the research director for a national commission on the social determinants of health in the U.S., sponsored by the Robert Wood Johnson Foundation. And throughout her career, Dr. Braveman has collaborated with local, state, federal, and international health agencies to translate research into practice with the goal of achieving greater equity in health. Thank you for meeting with us today, Paula.
My pleasure.
Paula, we've known each other for some time now, but it occurs to me that I don't know a lot about your background, where you're from, where did you grow up, your parents, where did they come from? Tell us your story.
When I was born, my parents and my older brother lived in a Boston slum with my grandmother, my maternal grandmother. And I guess when I was about 1.5 years old, we became more upwardly mobile, and then we lived in trailer parks for the next few years, but ultimately settled in North Miami, Florida, a white working class suburb of Miami. At that time, Miami is still very segregated, but it was even more so then. We spent summers in the Boston slum with my maternal grandmother, but the school year was in Miami. About my parents, my father didn't complete the 10th grade. He was too rebellious, getting into trouble all the time, and got fed up with teachers telling him what to do. So he hadn't finished the 10th grade. My mother had graduated from high school, would have given her eye teeth to get to go to college, but that wasn't in any way a possibility for my family. And my mother was a homemaker. My father sold advertising for small town newspapers and was very ashamed of what he did because he was a profoundly idealistic person, I think. But he somehow couldn't find his way to work that would let him express his idealism. And he made very decent money at this job he had selling advertising to small town newspapers. And that was a big lure. Perhaps if he had persevered more, looking for another niche, one that would let him express his sense of social responsibility, it might have gone better for him. But as I grew up, I saw how bitter he was and how unhappy. And I vowed to myself that it wasn't going to happen to me. I worked that would be really meaningful to me because I saw what it did to not have that.
So is that what drives you to do the work that you did or have been doing over the years?
I think it's fair to say yes. Yeah, I think it is.
Did you have siblings?
An older brother.
So with that background, your parents were able to produce a daughter that did go off to college, apparently, and obviously succeed spectacularly. What do you attribute that to?
I think it reflects in large measure how much they wanted me to lead a different life from theirs and to succeed. So there was a lot of encouragement about school, and education was just so highly valued and not taken for granted.
Yeah. So growing up in North Miami and in Boston, these were not environments, I would imagine, where there were a lot of college educated people living. So that influence came mainly from the home.
Came mainly from the home, but I think it also came from seeing what the alternative was if you didn't get an education. That was pretty motivating also.
Yeah. So after you graduated high school, you went off to college. Where did you go to college?
I went to Swarthmore College right outside Philadelphia.
Yeah. And why'd you wind up at Swarthmore? The Fighting Little Quakers, is that right? Is that the Oh, yeah. Shout out to Swarthmore.
I didn't know people who'd gone to college, except I guess perhaps the teachers that I had in high school. So I didn't know about what different colleges were like. And I participated in a summer program at Cornell University the summer before my senior year in high school. It's a very high-powered program where half the kids studied the writings of religious mystics to the writings of those who had taken psychedelic drugs and written about their experience. So all the kids in that, it was a very selective program nationally. I think they selected kids largely based on SAT scores. And a lot of those kids talked about Swarthmore and that the education was great. And that the atmosphere was also very, very focused on the academics and on thinking big thoughts.
Well, it seems like you fell into the right crowd. Peer pressure can actually be good sometimes, apparently.
Sometimes.
The choice. So after Swarthmore, then where?
At Swarthmore, I majored in philosophy, and that's what I thought I wanted to do, was be a philosophy professor. But this was the years 1966 through 1970, and there were some things going on in the world, including in the U.S. And I think I was very affected by the anti-war movement, the anti-Vietnam War movement, the civil rights movement. People at Swarthmore were very active in both those movements. And I think by the time I reached spring of my senior year at Swarthmore, I was feeling like becoming a philosophy professor was a bit too removed from the fray, but I didn't have a clue at all what the alternative would be. And I did have a boyfriend who was much in the same situation. And we went seeking the answer. Where is it that we could plug in and make a contribution to struggles for social justice? And that might be a longer story. And there's time on this podcast to tell.
You've got time, and I think you're a very fascinating person. So we're happy to hear as much of it as you'd like to share. So where did you and this boyfriend decide was the place to go for you to find where you would make your contribution?
Well, we didn't really decide. It was decided, I think, for a number of reasons. I hope that there's no really young people who are going to be listening to this podcast, because when I say that we hitchhiked around for about 4 months or so, it was a lot safer to get. That's now my remarks are directed to the young people there. Don't do what I did. It was a lot safer then. That was something. There were a lot of young people like my boyfriend and me who were on the move via hitchhiking at that time. It's too dangerous now. So we hitchhiked around. We hitchhiked up into Canada and across all of Canada, and then down the West Coast and then back up the coast. And we ran out of money in Portland, Oregon. And my boyfriend had a friend who was living in a house with a few other people, and they had a spare bedroom. And we settled there. We had some brief interludes where we tried our hand at being farm workers and found that we were really terrible at it. And this was 1970, and working in a factory, which had a certain romantic appeal, knowing nothing about, what it would feel like to work in a factory. That wasn't an option Then they were laying people off some factory jobs in 1970. So we went to temporary agencies to find work. And I remember in my first visit to the temp agency, the agent there told me there was just no possible way that she was going to send me out to an office, even though I had the skills, because I looked like a hippie. So look at your hair, look at your clothes, look at your shoes. I can't send you out to an office. So that was very discouraging. But then a week later, I got a phone call and she said, we have the perfect job for you at the hippie clinic. This was a kind of a clinic that up around that time, a lot oriented toward alienated youth, runaway.
Yeah.
And they needed somebody who was like an all-around assistant and could read and write and type a little bit. So I got this job at this clinic, and my boyfriend and I started reading things that were coming out of movements working for justice in the health sector. And we started, even though we didn't want to be at a clinic for alienated youth our whole lives, looking at what was happening elsewhere, we got pretty excited about being in the health sector in some way. It was a time when the Black Panthers had free clinics in communities. Women were organizing self-health clinics. A lot was going on. An organization called Health Pack was publishing these brilliant analyses of the health sector in the U.S., one in particular called Billions for Band-Aids, which I think would still be applicable, very relevant now. Yeah, so we got interested in the health sector and tried our hand at being a nurse's aide at the Veterans Clinic, because I think it's still in my mind the truly worthwhile thing to do would be to be an organizer and a working class heroine. I think I found after a year and a half of working as a nurse's aide at a veterans hospital that not a talented organizer at all. I think that job as a nurse's aide and really feeling what it felt like to have a job that was really low on the totem pole made me very seriously reflect on whether that's what I wanted for my life. And I started thinking about what I could do, given the fact that I did have a degree, a college degree from Swarthmore. I had privileges that none of the people I was working with who were nurses' aides, they didn't have those privileges. And reading about Norman Bethune, Canadian surgeon who went to China and provided medical services that helped the Chinese Revolution, and other fables like that, started to think about the possibility of going to medical school and to embrace it. So not your usual route at all. And if somebody had said to me before then that I would wind up going to medical school and being a doctor, I would have been very offended, because it was too much like being a plumber, I thought. And I thought of myself as an intellectual, you see. But there I was, taking advantage of the privilege that I had.
Yeah. Where'd you go to medical school?
Here at UCSF, University of California, San Francisco.
But so, you just made a comment, taking advantage of the privilege you had, which you did. The Swarthmore degree was a privilege, and you was able to use that to move from this low-wage employment into medical school. But I would also notice, and just kind of look at your career, you've used your privilege as a professor at a major medical school, I think, to advocate for health equity. So I think in many ways, I can see the pattern beginning from Boston and Miami all the way through your days hitchhiking through North America. I don't know if you can call yourself a hippie. You just said you looked like a hippie. And for your early work, I'd asked you to share a few papers with me that you thought was illustrative of the arc of your career. And the early paper was work on health insurance, among the impact of pregnancy outcomes among women that did not have health insurance in California. So tell me about that paper. Just what were the findings there, and why did you think that that was a critical paper for us to talk about today?
It was the first major paper that I wrote. So that was one of the reasons to pick that paper. In that paper, we showed that newborns who were uninsured were much more likely to have adverse health outcomes than compared to newborns who were insured. And we showed that the Medi-Cal, which is the California Medicaid, the Medi-Cal covered newborns were somewhere in between the uninsured and the privately insured in terms of their outcomes. We did that paper using, what had been used almost entirely as administrative data up to that point, hospital discharge data in the state of California. And I think to that point where there definitely was a movement at that time to get universal health insurance. There were a lot of people around the country who were striving for that. But at that point, my perception was that primarily that it was the bad guys who had the data. And the good guys, all the good guys had, when push came to shove, was the feelings, the righteousness. And they were at a real severe disadvantage. There just wasn't much hard data around. And a lot of people were saying those who wanted to justify the status quo would say, so at that point, it had been revealed that there were a lot of people who were uninsured. So that base had been covered, but there really weren't hard data tying being uninsured to bad health outcomes. And the defenders of the status quo would say, oh, yes, there are a lot of uninsured people. The safety nets are there. They're being taken care of by charity care, by community health centers. So there's really no problem. So this paper actually probably made the biggest splash of any paper I've ever written and got huge press because it was saying, no, that's not true. This is drawing blood. The lack of health insurance is tied to adverse outcomes.
So just for the audience, this is a paper in New England Journal of Medicine, 1989. And I think especially for younger people who grew up and lived in a world with prenatal care, that it really wasn't until the mid-60s with the perinatal collaborative study that we started to get really high quality research that documented that prenatal care actually made a difference. So while today that finding from your paper may not sound like it's earth-shattering, it actually was for the time. People didn't know this or hadn't acknowledged it or hadn't been documented that medical care did make a difference.
I think that was what made the splash.
But then later in your career, you seem to move away from the healthcare system as the place for the intervention. And I know that your later work focuses a lot more on more of the academic side of this, kind of defining and conceptualizing concepts like health equity, health disparities, structural racism, what these terms mean. Tell me about that, how that transition occurs as someone who's trained as a physician, starting out doing work on prenatal care and its impact, to someone who's really broad and far beyond the medical care system.
After I completed a residency in family medicine at the local county hospital, I got what at that time was my dream job, which was working in one of the original Office of Economic Opportunity funded health centers in San Francisco. And working as a physician there, I quickly came to the conclusion that for most of my patients, the issue wasn't so much the medical care, but the conditions in which they were living and the stresses, the stressors that they were experiencing. And I don't think I articulated that, but I think I was feeling that and feeling the limitations of what I could do as a physician. I worked as the doctor at a local high school, the only high school in San Francisco that had a school-based health center. And working with adolescents was always my my favorite, the most fun. But there too was what these kids were up against at home in their lives outside of school. It seemed so much more daunting in a way. But I persevered in my research. I persevered looking at essentially at disparities in healthcare. But 90s literature was accumulating, calling into question just that prenatal care as a panacea for birth outcomes. And that was shaking me up, I think, that literature. And at the same time, more attention was being given to the concept of the social determinants of health. And by social, what people have referred to it, they really mean the social but not medical care, those factors outside of medical care that influence health. And that literature made so much sense to me. And, fed by these experiences, both the experiences as a physician and then as a researcher looking at birth outcomes, that I made the leap. And I was lucky enough to have a sabbatical. It was the one sabbatical I ever managed to take. And I spent a lot of time that sabbatical just trying to get up to speed in the literature on the social determinants of health. I felt like fish in water in that literature.
That was certainly a productive sabbatical because you went from reading that literature to helping to define a lot of what we mean by some of these terms. So in the 90s, really starting in the 80s into the 90s, we didn't even really have good terminology to talk about this problem. But I know that some of your work really helped to frame what the terminology was. For example, defining health equity as the terminology, which we now use as we talk about this issue, as opposed to health disparities. Or back in the 80s, it was just race differences in health. That's how we would talk about it. So what was your thinking there about why you decided to start doing that kind of work, defining these concepts and helping to create foundations for the field?
There is a very discrete event that I would point to. It's responsible for me going in that direction. And that was that a couple of very influential people who were at a very major organization came out with this notion of that they had developed a much better way to think about and measure health inequalities. There were a couple of people in leadership positions in a prominent international organization, and they were both very bright. And they presented a paper at a meeting. I wasn't there, but I heard about it, in which they were proposing a different way of measuring and thinking about health inequalities. That's the term used everywhere except in the US. So we say health disparities, and everywhere else it's health inequalities. And the approach that they were suggesting had a lot of lure to it because, it's very difficult to get health data that are appropriately disaggregated by markers of people's level of social advantage, by race or ethnic group, by social class. That's often we lack the data sources to do that. And what they were saying, we're just going to measure health of everyone. And then, how big are the differences in health?
I mean, the distribution across the population.
Yes. Yeah.
So the least healthy from the most unhealthy, and kind of what's that gap?
Exactly. And, it would have made life a lot easier to adopt that. But there's just one little problem, which was that it entirely removed the social justice content of the concept. And initially, I tried to poke holes in what they were doing from a technical point of view. But at a certain point, I realized this isn't about a technical issue, that what they are proposing is removing the social justice content out of these concepts, which were introduced in order to look at social justice. And that we need to, when I said we, that people who care about social justice need to take this on head on and directly and talk about values and talk about the fact that what they are proposing does not answer the questions that we have. Our questions are about social justice and about who is faring well and who is faring ill, with comparisons by people's level of social advantage. So that really is what turned me in this direction. I think if that hadn't happened, that proposal by those influential people, I don't know that I would have invested as much time as I have and continue to invest specifically in trying to promote clarity about what we mean when we say health equity.
So carrying this theme forward around promoting clarity. So I noticed an article that you published this year in Health Affairs. You're talking about systemic racism, structural racism, trying to clarify these concepts and differentiate among them. Say a little bit about that paper and kind of what you were trying to do with this one.
That paper represents an attempt by me to reach out to a broader audience than the audience that I think is generally reading about and hearing talks about issues like structural racism and systemic racism. It represented an attempt to speak to our wider audience, wider but not widest, we might say. I mean, that Health Affairs, the readership there, I think the appeal there is that it's read by a lot of policymakers who are not reading the health literature. So it was an attempt to try to be as clear as possible and get the jargon out of the way.
So I think this is an important point here that I want to stress, especially for younger scholars who are coming up, that the three papers we've talked about, the first one on prenatal care and pregnancy outcomes was New England Journal of Medicine. The paper, and for those listening to the podcast, we will post the citations to these papers on the webpage, so you'll be able to get to them if you want to read them. The second one was American Journal of Public Health, 2011, where you were talking about defining health equity, defining the terminology, and sort of beginning to create the lexicon that we use now as we talk about these issues. And this latest paper is Health Affairs. It seems, if I'm reading you right, that there's a theme here where you select journals not based on just, hey, I think I can get published here, but rather, who's the audience that I'm trying to reach? So talk a little bit about that, about how you try to link your message to the audience and how, the importance of doing that as opposed to just writing an article and just submitting it to a journal.
I became a researcher out of a desire to contribute something to struggles for social justice. It wasn't just the fascination with research, although I'm very lucky. I love doing research, so that wasn't a sacrifice at all. But I think I might have found other things like being a philosophy professor that were gratifying. But I think that's central for me was feeling like I'm contributing some little thing. I've never thought that any one individual generally can accomplish very much. Whether we have any influence at all probably depends a lot on what so many other people are doing and whether things converge. There are, a number of us doing things that are mutually reinforcing. But anyhow, I saw my niche in doing the research that would get into the policy debates and contribute to a more justice-oriented ethos. So I think it just follows from that I had to look at the audience. I mean, for some papers, I've had more choice than others. Not all papers that are even going to stand a chance with certain journals, but within the realm of what might be a fit, might be a possible fit, it would always make sense to choose the most influential. Also say that in this vein, for the last, 14 years, maybe I've worked with the Robert Wood Johnson Foundation on producing materials, a series of issue briefs that reach out to a way broader audience than any academic journal. And that's been profoundly satisfying. And it has helped me, I think, working on the issue briefs and having the input of people who have some communication skills, which people like us are never trained to have. I think that has helped somewhat, even in the writing that I've done for more academic journals.
So I'd like to close out with this. So to the next generation of researchers, what wisdom would you impart to the next generation of researchers? Where do we take off from where we are now, and how do we build going forward and continue to move us towards this equitable society that we've been working on for the last few decades?
I would appeal to the next generation of researchers to focus on really important questions, including questions that have implications, strong implications for social justice. That, it has become, in the last 10 years or so, I think there's been a big shift in the acceptability of research that does incorporate a social justice perspective. And I know that you are younger than I am, but I think you're still of a generation about somebody who has published studies that are important for struggles for social justice. That's certainly you, and I would bet that even though you are younger than I am, for much of your career so far, you had to have the guts to do that, because it wasn't going to get you ahead. And in fact, it was going to get you suspect as somebody who couldn't be a good scientist because you're motivated by values. But I think during this last 10 years, there has been a transition, and the newer generation does have it easier than we have had it. I don't think it takes much courage for them to focus on these tough questions and the comparisons of the haves and the have-nots, and the exploration, how to understand the disparities and what needs to be done about them. It's not as hard, at least for right now. We'll see what, there could be another sharp turn, and it could then, again become more like the situation that you and I have faced, where you do have to accept the fact that some people they're not going to be pleased at the research questions that you've chosen.
Yeah. Well, thank you, Paula. Thanks so much for this great conversation. And as always, it's a pleasure talking with you. And thank you also to our listeners. We hope that you found this engaging, and we look forward to having you tune in for the next episode.
Thank you for joining us this episode of Partners for Advancing Health Equity. Be sure to visit our website and become a member of our collaborative at partnersforhealthequity.org. That's partners, the number 4, healthequity.org. Follow us on Facebook, LinkedIn, and Twitter. And be sure to subscribe wherever you enjoy your podcasts. Partners for Advancing Health Equity is led by Tulane University School of Public Health and Tropical Medicine, is part of the Tulane Institute for Innovation in Health Equity, and is supported by a grant from the Robert Wood Johnson Foundation. Until next time.